Thank you for taking the time to tune in with us. Here on Unclamped, we recognize that every patient and caregiver carries a story, each one shaped by unique experiences, challenges, and triumphs. Before we dive in, we want to take a few minutes to introduce ourselves so you can get to know the voices behind the mic, the journeys that brought us together here, and the passion that fuels this space. Because this isn't just a podcast, it really is about community, and every story matters. Hi, everyone. Today's episode is going to be something very practical, something we all think about and have questions about, how to maximize our appointments with our nutrition support team. So today we're going to take you step by step on how to prepare and make the most of your visit.
It's not always about the language you use. It's especially when it comes to medical language. So be yourself when you go into your appointment. And as a patient, it's one thing I wish I knew ahead of time was clearly how to have a successful appointment.
Yeah, so today we're going to walk through, like I said, step by step, a very repeatable process that once you master it, hopefully it'll help you make sure that you get your needs met at each appointment. So today we're going to talk about the top priorities. So before your appointment starts, the first skill is learning how to choose priorities before your visit.
Yeah, appointments are limited, as we all know. Some are like very quick and it's like in and out. So, like choosing what's most important for your appointments, I think is like the most important thing to do.
And when I go into my appointment, I always think, okay, what are the two? I ask this to myself all the time. What are the 2 or 3 things that I must know or must get out of the appointment today? What will that be? And then I go into the appointment.
Yeah, no, definitely. And I mean, like, prioritizing might be like symptoms or noticing a trend. You're not able to tolerate when you have lipids versus just, your 2-in-1 solution, things like that, things that, you're noticing that are a problem, whether it might be your care plan too, like if it's just impacting your daily life and your sleep quality isn't good, just all the things that you wish were better or you want better answers to.
Yeah, and I don't think like it has to be perfect, but I like to write down things in a notebook, and it's not like a big fancy spreadsheet, but it's like kind of like you said, like the trends, what's been happening, what I think is a little concerning. It's just kind of like, quick notes.
Yeah, because that oftentimes will help your provider know what direction you want to go in when you start the appointment. Mm-hmm. Having it laid out, knowing that these are my top list things that have to be, addressed is just super helpful for everyone.
It could be as simple as how much nausea you're having, if you have increased outputs, if there's a problem, if you have a feeding tube, if there's something leaking going on there, or for my central line, if I'm feeling more discomfort or pain, or it's harder to access. These are all types of things that I would make notes of to bring with me during my appointment.
Yeah, that makes total sense. And I also like to kind of just get the administrative stuff out of the way first too. So one of the things we do is we look at our medication list because they're always going to ask you to reconcile it. So right off the bat, like, these are meds that I had stopped since the last time I saw you. These are the meds that I'm currently taking, and looking at the refill, or at least prompting your provider to look into your orders and see when you need refills or a new PA, because those things can hold up process. And, when you have them right in front of you, it's just so much easier to talk about that stuff and get it out of the way versus having to send them a portal message.
Mm-hmm. Yeah. When you go to the doctor, they're not hopefully doing any physical tests on these appointments. You would be knowing that, but it's not a quiz, even though it feels like it when they're rambling off questions. One of the questions that you will be asked every time is if you've been to the emergency room or if you've been hospitalized. And oftentimes you'll need to bring, if it's an out-of-network hospital, make sure you bring your discharge summary. They like to read that. So just a quick tip to doing it.
I like to also keep track of how you said, Crystal, you said something, but that reminded me that I also like keep track of the trends. Like if my son's central line is sluggish, then if it's like after iron infusions, and I'm like, oh, this happens, after this. And then I let them know because they don't know. Like they're not in my house to know if that happens every time after iron infusions. So I like to keep track of that stuff too and share it with them.
Yeah, that's a good point. I know for us, we have a lot of different specialists. So, and oftentimes we'll get different recommendations because everyone's looking at their, through their lens. So I also like to kind of bring in either like the discharge summary or just have like a note of reference just to share. Just information sharing, prompt, hopefully, communication amongst the team. But I know, that's a tall order. So hopefully like bringing that to the appointment, like this is what our neurologist is saying, this is what, our cardiology is saying about the POTS, like just kind of giving them the opportunity to have that global view of everything that's going on in your life, because the nutrition support really is like a primary driver of care. So having everyone kind of work together, and if you can't make that happen, at least kind of bring everything to them so they can look it over all at once.
And that's especially key when we are talking for an adult like me who's seeing also pediatrics because of my myopathy. My mitochondrial myopathy is done at Children's Hospital, so they don't always communicate with the adults side. And my neurologist having doctors in multiple systems, they do have access to the electronic health records. However, it seems to be less communication goes on that way than it would be if you're under one central, like Gabby's son is in one primary hospital system, and so they can more easily communicate with each other versus being in multiple hospital systems. You tend to have to be facilitating the conversation between your physicians more.
Mm-hmm. And even in like one hospital system, our primary care is in the same building and sometimes doesn't like share things with our team. So I always, usually after our year, we only see primary care usually like yearly or if he's sick. So after our yearly, I'll update, our care team because they're the same system, same building, and sometimes things still, get missed.
Yeah, no, you make a good point. I know for us, our pediatrician does all of like the nursing authorizations or like the care plan for school. But yeah, the nutrition, like it's driven by the nutrition support team, but they never talk. It's kind of like two ships, it's very siloed care, which can be challenging for sure.
Yeah, we get our orders for like summer camps and stuff from our specialty team says get it from your primary care. And then the primary care starts it and then refuses to finish and sends it to the specialty team.
Yeah, it's a lot of hot potato.
Yeah. I was going to say a circus, but that works too. You're the ringleader. And for both of you ladies, you get to be the ringleader versus when you're a patient, an adult patient, you are often the ringleader and the patient at the same time. So it can be a little taxing at times. So it's always good to have some help in that. Which is why reviewing your medications really thoroughly and doing as much, like you were saying, Jamie, ahead of time before you get into that appointment can really make your appointment go smoother. So when you're reviewing your medications and your supplements on purpose, and you're not really just listing them, you're really going over each and every one of them, and you're ensuring that what each medication does. So a lot of people can list their medications, but they don't know what their medications, why they're on their medications. Mm-hmm. And knowing why you're on each medication is critical.
Yeah, I agree. That's what I started doing, with Olivia as she started getting ready to take over and go off to college, with naming the medication and then why are you taking it? Mm-hmm. And at first it was like, well, I don't know, because you tell me to. And then it kind of evolves into, okay, now I know this is the med. This is why I'm taking it. Is it helpful? Has it made things better, worse, or the same? And just kind of judging it that way too, so that you know that there's options. If we went through a whole list of migraine, prophylactic migraine medications, we even did an infusion to try to support that. And, you just have to keep monitoring it and, don't be afraid to say it's not working.
Yeah, and I'm actually going through that right now with my reflux medication. We have to change it because my absorption of what I'm on I guess technically currently am on, I can no longer absorb in the manner which it's a pill and I cannot absorb it anymore. Versus, so we try to, and that doesn't come in a capsule. So we tried a different type of medication, still under the same general mechanism. However, the adverse events I was having with it, we had to correlate it and then tell them and communicate back and forth. So knowing why you're on the medication and the side effects of the medication. And for me, it's not even the side effects, the direct side effects, because if you look at the list of the side effects, that's what I was having isn't directly one of those side effects. So knowing your body and knowing what types of side effects that you might anticipate, and so then you can report those types of side effects. If you have an increase in nausea, but nausea is not necessarily a side effect, or for me, I have an increase in dystonia or something like that. That's a big side effect. I'd rather live with acid reflux and have my esophagus burn than have facial palsies all the time and dystonia. So I'm like, can we find something different? And we often can work through it. So we're working through that now.
Yeah, I think the big one that I always ask too, and like to know, is like, how should he take the med? Or like he does feeds. So should we do it while he's on feeds, after feeds, before feeds, morning versus night, all those things. And there is a lot of his meds that can't be given together because it affects the absorption, or you should do this one with food, this one without food. So I think for me, along the way, I've learned that, but I now ask, like at appointments, whenever we're prescribed a new med, I'm like, all right, when should we do this? And I tell them how I give meds, like, should we do a morning, night, middle? That's been helpful for me.
And for the new people that are on, not every pill or capsule can go into different parts of your body. So you can't directly crush it and put it into your G-tube. So asking your physician or your pharmacist is key to that. So that's a good point, Gabby.
Yeah, I feel like that sets us up for our next skill, which really is, talking about real life conversations. Oftentimes our providers are seeing us in a medical setting. They've got their diagnostic hat on, and they're not thinking about all the external factors that play into your life. Whether you're working, you're going to school, you have to drop off or pick up your child at a certain time. There's just so many challenges that go along with being able to be successful on a care plan that I think it's also important to evaluate, like, how are my days? Like, do I like my day? And is there something different with my schedule or my routine that would make my day go smoother? And having that, like thinking about that first will enable you to have like a more targeted conversation with your provider and say, hey, listen, like, I have to get my son, on the bus at 8:30 and, I'm still like, I'm not ready. Like I still have to take my meds. There's certain things I have to do. Just like situations that come up that make it harder for you to do what you need to do to take care of yourself. I think that that's important.
Yeah, it's not your fault, right? Being able to live your life isn't your fault that your nutrition plan doesn't fit your schedule. So definitely do not try blaming yourself when you'll hear like, oh, you're not being compliant, or it's not that you're not being compliant. Your plan doesn't fit you and doesn't fit your life. So have the conversation to try to figure out what works for you. And that's where having the notes and writing down like, hey, I'm having a really hard time with a 12-hour feed. Is there any way we could make it 10 hours or 11 hours or even 11 and a half hours? Because we all know sometimes that little half hour makes a huge difference. So making those adjustments, or if you're enteral feeding, like Gabby's son does multiple different modalities, right, Gabby?
Yep.
So having those conversations as to what works when and where definitely helps. And I always have the conversation with real life about when I need to change my schedule. So if I'm home and everything is, quote unquote normal days, then as I think everyone knows, infuse during the day. However, when it's summer or if I'm somewhere and it's warm and tropical or whatever, and I want to go swimming a lot, or be muddy or whatever activities I want to do that involves dirt or water, I then infuse during the night so I can, I'm going to feel more tired and stuff, but then I can de-access my port. So having those conversations and it's real life. Like we need to roll with the punches. So.
Yeah, I think not being scared of just kind of being open about real life is something that I went through at first, and something I think like families think, oh, it's not like medical related, it's not important, but it is. Like that's how we've got to feeding all different ways, because we were like, well, on weekends this doesn't work and on school days this doesn't work. So, and we kind of ended up with this weird mixture of feeds, but it works.
Yeah, and having those conversations ahead of time also alleviate anxiety in the moment. So,
Yeah.
like my son's at a point where, he likes to sleep over a friend's house. So what does that look like? I'm not going to call my provider like the night before and be like, my son was invited to a sleepover. What do I do? So we plan for those things, and I'll ask permission, like, does it make sense for him to infuse like during the day, and then I drop him off at the tail, like at 6 o'clock after the infusion, and let him go, with nothing until I pick him up. Like, is that something that you would support? Should I give extra hydration? What does it look like, and how can I be successful in making sure that he's not limited on what he wants to do? So having those conversations has been so helpful. Because like real life happens,
And it should happen.
Yeah, it needs to happen. That's why we're doing this. I mean, if we're going to be on a life-threatening therapy, you better live, right?
Yeah, and it's not just the patients living, it's you ladies that are caregivers too. You guys have a lot of responsibilities, and it needs to fit into the patient's life, but it also needs to fit into the whole family's life and the caregiver's life. So like, if things are interfering with your life, you need to speak up as well. It's not just, hey, this is working perfectly fine for my son or daughter that's 3 years old, but it's not working for me because I have to get up, like if it was a child that was bottle fed, by the time they were 2 or 3, they'd be sleeping perfectly fine, hopefully most nights through the night. But if with nutrition support, for some reason you're getting up several times a night, like they were infants, and having to do something for the feeds. Well, that's not working for your life. So have that conversation. What will make it work for the whole family's lives?
Yeah, I know for us, just kind of piggybacking off children, you know, when you go through that transition of pediatric to adult care and like, you know, priming them to make sure that they're ready, because adult care is different. I think that there's a lot of preparing that you can do ahead of time so that your child feels confident and successful. So what we'll do is, you know, first I start with, you're seeing Dr. So-and-so. Do you know why you're seeing them? You know, sometimes I get a yes, sometimes I get, I don't know. So we'll start there, right? Okay. So you're seeing, you know, we're seeing your nutrition team. You know, what do you have any concerns about your TPN? You know, any concerns about how you're feeling, how your weight is? I mean, my daughter's a young woman, so you know, all her life we were just trying to get her to gain and grow, gain and grow, gain and grow. Well, now she's 19 and she doesn't necessarily want to gain anymore, right? You know, that's no longer the goal. The goal is to maintain and have a healthy lifestyle and be a healthy weight. So just kind of having that conversation and what, you know, it looks like for her, I think is also really important, because that way when we go in, you know, and they're like, how are you doing? She's not just like, good. And I'm like, really? Like, we had like 10 things that you said weren't good. So, you know, I like to be able to step back and be more of a support person versus the reporter in the room, which is nice. And if you set them up correctly, you know, and their confidence is there, it ends up being a really good appointment.
From the patient side, having the space to actually answer the questions and also be able to really have the support, even though I'm not a teen, far from a teen, having the support in the room with you, because, you know, middle-aged adults forget too, especially when you're tired and you had a long appointment. So having someone there with you really does help. But that leads me to a question for you, Gabby. Your son is younger than Jamie's. How much control does he have in the appointment?
So right now, so he's 9. So he checks into his appointment on his own. I think he's been doing that for like 2 years. I'm like, all right, go ahead. And he goes, you know, he checks in, name, date of birth, and all that.
I love that.
That's like, I think the first thing we started doing, because that's easy enough. They'll talk to him a lot now, actually. They'll ask him how he's feeling, if anything hurts, you know, like if he has any concerns. He doesn't say much right now. But I will, when I talk to the team, then I'll actually turn to him. I was like, what do you think? You know, or just kind of seeing what he says. Sometimes, most of the time it's the same, but sometimes it's different. He's like, no, that doesn't hurt. I'm like, okay. Like you said, it hurt, but fine. So yeah, I still do a lot of the talking, but he's always listening. I do have him now. Like, I'm like, when the doctors come in, you mute your tablet, you pause your tablet, and you pay attention, you know, so he's more involved for sure.
Which makes a lot of sense, because, you know, you want to get him to be that independent adult, and, you know, 9 is getting there. He's
I will say,
he's halfway there.
When he wants something, he'll say it, because I think about a year ago, he, you know, it was getting hard because his school started earlier. So like he was on 12 hours of TPN. And at that time, like our team typically stays around 12 hours when you're full TPN dependent, just at around his age. And he went into clinic. He's like, I need 11 hours, like out of nowhere. And I was like, oh. And they were able to put him on 11 hours. So he will speak up if like he feels like he needs a change or something.
And he's really proud of those 11 hours. When we were at DDNC, he was like, David, how long are you on TPN for? He's like, 12 hours. And your son was like,
I'm waiting
11.
for him to ask him. Yeah, he's like waiting. And he's like 11. But I think it was probably one of the first real times like he advocated for himself. I didn't know he was going to ask. Like, you know, it was all on his own that he brought it up. So
that's really good. Learning how to do that at a younger age is important because we're not always good at doing it at an older age. So doing it at 9 is kudos for him. Good job.
Yeah, no, for sure.
But it's really just a balance and understanding where we are in the journey of our lives. If we're in our childhood, if we're in our adolescence, or in our adulthood, we all need support, and it's different support at different times. But it's really as Gabby's son fully demonstrated at both the doctor's appointment and with our SmackDown and DDNC, the SmackDown and DDNC of I'm 11 hours, you know, showing up the older teen. It really is just building confidence instead of making it feel like a pressure situation. It's building confidence so you can have those conversations.
Yeah.
So that's all the stuff we do ahead of time. Now, the day of the appointment, that itself, initially, we need to prepare for the day of the appointment, right? So our appointments can look completely different. I can have my nutrition support appointment is normally 1 hour, but in that 1 hour, even I need to consider it took me an hour to an hour and a half to get there. It's going to take me an hour to an hour and a half to get home. So, and you're there, 15 to 20 minutes early. So this can be a really long day, even for a 1 hour, which isn't really that long, but a long enough appointment. So what do you all need to do to be prepared for just the time it takes and the energy it takes to get to the appointment and have the successful appointment and then to leave? Because if you don't have the energy to have a successful appointment, and if you don't have somebody there to back you up, for example, you obviously, your kids do because you're there, but having that energy to have this successful appointment is really key. And then also ensuring that you two ladies, have the energy and the hydration to make it through the long day of medical appointments is important. So, like Mike said, mine's an hour, but I know some people's can be anywhere from 2 to 6 hours at times actually in clinic, and that doesn't include the travel time. So what do you do, Gabby, to prepare for that?
Yeah, I think it took a little bit to figure out, but I wish like someone would have told me to kind of just try to create a routine. We have a routine that we keep and it's amazing. We just kind of, we know it takes us like about an hour. We're always trying to be like 30 minutes early. So, we calculate all that. Usually if it's early morning, we'll stop by and get like protein shakes and that'll be kind of like our breakfast. Then, usually if it's an early appointment, we have other things scheduled before our care clinic. We'll do that. Then we'll get lunch. We take our lunch to care clinic. And then at least now our appointments are usually at least 3 hours usually. And so now we have food in clinic and we eat. That kind of helps, the time pass. My son always brings his tablet. He has a Xbox remote that connects to the iPad where he can also play games. I usually, if I have to study, I'll bring my study guide or I'll bring my computer. I'll bring something to do. And then, we always make sure we hit our floor has a treasure chest. So usually at the start of his appointment, he hits the treasure chest. So then he has a toy as well to play with. And we just kind of have our routine that's not medical routine, but that's what helps us get through the long medical appointment. He
Yeah,
usually
I
has
know.
the day off school too.
Yeah, so
We
we'll do
used to
that.
try to cram. We used to try to cram like school with appointments, and then we realized like it's just too much. So we take the full day off school usually now.
Yeah, I was gonna say, we check in with his school. Like we'll tell him, like this week is your appointment. Make sure you check in with all of your teachers. Depending on the time of day that it is, we'll determine if and what's going on. He's big into track, so after school practice is huge. So we also try to schedule appointments, earlier in the morning so that it doesn't interfere, with that track practice time and getting him back to school on time, and having that school note, because truancy is real and you have to always have that note to make sure you're covered. And snacks, I agree. We love snacks. Have your computer, just have things to do, make sure everything's charged. We always anticipate a wait, and hopefully we're pleasantly surprised that if they're running on time, that would be great.
And then the last thing I would add for that is it really depends if if they're going to also be looking at your tube, whatever tube that means. If it's your central line, if it's your G tube, your J tube, wear something that makes it more easily accessible, so you don't have to fully undress to be able to see the device. It makes it, I think, more comfortable. I always wear comfortable clothes anyway when I go to my doctor's appointments because they can be a long time. But I want to make sure that they can easily, if they need to look at my central line, they can easily access the area to check there's no redness, there's no blah, 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 and, do any palpations that they need to do. So those are some of the things on the day of, before you actually get into your communication with them.
Yeah, having a clear language during the appointment is huge. It's a proven fact that most providers will interrupt within the first 60 seconds of a patient talking, and that can take you down a completely different rabbit hole. And then you're 45 minutes in, and nothing that you actually wanted to get, settled is settled in that time. So I think that, when you prioritize it, you already have your list, you already have this is what I want to talk about, this is what I need, lay it out. Make sure you get it all out. If there's 7 things, say all 7, because then it helps the provider help you prioritize what really needs to be discussed and determine if maybe there's another visit that needs to happen, or even a continued conversation via the portal. But then you're level setting every expectation right out the gate. Like, I'm here today. I want to be respectful of time. These are my things that I'm coming with you today. And it's not rude, but it's effective, and providers actually appreciate it, because then everyone's on the same page.
Yeah, I always have it written down, easy to discuss, because I'm going to inevitably forget something. And if they do interrupt me, which they always do, and I only get out a couple of the things, I can then tell them later what I want to communicate. If I need to send them a message to the portal, call them, email them, whatever, to make sure you do go over it. And ironically, in my visit, we always start with the medications, right? So actually, my nurse practitioner will go over each of the medications with me instead of the MA, which often happens. But in my nutrition appointment, they go over that, which can be a little daunting because I'm on 27 medications. So that in itself can take a good half an hour of the appointment time. But knowing it and being able to quickly go through it, and then also really during that time, if they're making any changes, I also use that time to, get in some of the things that, oh yeah, with this medication, because of this, I want to change this, or wow, you're looking at that, I might need to do this. So if there is anything that's inconvenient with those medications, I try to really point it out as we're going over the medications, so that they know then and they can make note of it. But it also, as I'm going through my priorities, because always the first thing that they do is hi, and then let's go over your medications for me. So it's not even, what do you want to discuss today or anything like that. It's literally hi, and this is your medications list. So.
Yeah, I think another key thing is asking questions like clearly, and not feeling like you're questioning them, or asking them without like apologizing. I ask tons of questions. That's just like who I am. Everywhere I'm at school, at the doctor's, I'm just like, okay, why are we making that change? And what do we expect to happen because of this change? What are the side effects? What happens if it doesn't help? Just so I know, okay, if this doesn't work, am I calling you? Are we having to come in? Like, what do I look for? So I think that's a big one. Just ask the questions. Don't be scared.
Yeah, that why is so important to me too. Like if we're changing, the TPN, I love to be educated. I'm like, well, why? Like, tell me why we need to do that. And then after they do, like you said, like, I'm like, okay, but I am a very need to know, teach me, cause I want to learn, cause then it'll help me better take care of my kids.
And asking why, for me, sometimes is why not? So with all my doctors, sometimes I'm telling them, hey, did you see that note that we need to change X? Let's say we need to add B12. My B12's low. Well, they check it, but my neurology likes it higher than they do. So because of that, hey guys, we need to increase my B12. So did you guys get that note? No, yes. So I'm often driving some of those conversations. And then if they say, no, we can't do that. And I'm like, well, why can't you do that? Because you can. Why can't you? And if you don't have a valid reason, then I keep pushing. Or I find another. I go back to my neurologist and say, hey, they want to do it, so can you do it for me?
The other thing that I think is really, it's kind of new, and I don't know how I feel about it, is AI during appointments. So during a recent appointment, you sit down and it's like, do you mind if I record this? And I'm like, wait, what? So AI can transcribe the notes. And I mean, especially when you're asked that and like the provider's right in front of you, it's like, I don't know, what should I say? I haven't even thought about this. I didn't even know this was a thing. And now I feel like I have to say yes. And I don't know, and I don't want to take away from the appointment so that you can explain how you're using AI to me. Like, so just thinking about that, is also really important. Like, how do you feel about AI transcribing your notes? Or like when you get that questionnaire through the portal to help like assess the problems, and your symptoms. I hate that. Like, I hate that assessment questionnaire, and I never fill it out because it's all like subjective, and that's an objective questionnaire and it's too subjective. So if I can't have a conversation with you about why I marked it this way, I don't want it in our record,
Yeah.
I agree. As a patient, I don't like it. Some of the questionnaires I will fill out if I know exactly how the questionnaire is going to be used. For example, when we're doing a questionnaire about my swallowing abilities, then I know, it's something we either do in the office and I answer the questions, or I've done it for the past, 10 years. So I'm very comfortable doing that questionnaire online. But a lot of the other questionnaires, I don't even like when they ask me what my pain scale is online, because I'm like, okay, this is my nutrition support appointment. Unless it has something to do with my nutrition, then what does it matter? Because they're not going to be able to do anything about my neurological pain anyway, or my migraines if it's not caused by my nutrition support. So I don't even like to do that, and I don't like my conversations being recorded. ironically, we're doing a podcast and I don't like my conversations being recorded. But in the medical settings, unless I can detailedly read the notes that's coming out of it, I don't want it to be recorded, because I do have a very dry sense of humor, and it has recorded things inaccurately for me. So if you ask me how something is going, and it could be going really bad, and I'll say, oh, it's going just peachy. And so they might take that, the AI takes that as, yes, she said it's going great. Well, no, it's not. And it's going horribly wrong. So I don't like that, unless because I know they don't review it as well as many, not all of them, but many of them do not review it for all the fine points in our medical records, and our medical records are messed up enough. I don't need something to add that's saying I'm perfectly fine with my, swallowing that day, when in all reality, I'm having problems controlling my saliva, for example.
Yeah, I've had it happen a couple of times. I usually don't mind, but I will say, like, so far I haven't minded, but I could see myself having like a day where I'm like, no, let's not, I need you to like hear me right now and like really get, what I'm trying to tell you. So yeah, I don't usually mind it, but I feel like it's okay. I feel like people should know that they can say no, that they don't have to explain why. They could just say, oh no, I don't want to, and that's it. Especially now that more and more providers are doing it.
Yeah, I mean, I feel like the only AI that I can 100% get behind is when it's like for interpreter services. I mean, that has become so valuable for people where, English is not the preferred language. So just because, a patient can speak English, they might not want, their care plan and the, the instructions on how to go home, spoken to them in English or printed out in English. So having the ability to lean on AI for that support, and the access to multiple languages is invaluable, because even if you have an interpreter, there in clinic, sometimes, if they don't speak that language, then it's useless. So having another tool that can pull, a plethora of languages, I think is incredibly valuable.
Yeah, and the appropriate dialect of that language. If you are speaking, we are not speaking English right now. We're speaking American, so that's a simple thing. But it sounds simple, but there's big differences. And then we know within several of the other languages commonly spoken in the U.S., it's really dialect. I mean, you two both speak two different dialects of Spanish. So yeah. So I would agree with you with that. So yeah, so capturing things correctly, and then
I think the final skill would, before you leave your clinic, is to make sure you leave with your answers, like your 3 answers. Like, who do I contact if there's a problem? That's a big one I always ask, especially when you're making changes and you don't know how you're going to react to those changes. How do I reach them? Should I portal message them? Should I call? Are we going to most likely have to come in? Just kind of like to mentally prepare yourself as well. And then when should I reach out? Like, after the symptoms are happening for a week, 2 weeks? Is this normal for a month? I think really leaving with, those answers is important, because then you're prepared for even your next visit.
Yeah, I agree with that. I also like to say, make sure that my understanding is the same. Because I might be receiving the information and not really understanding. So I always like, to be able to retell or be like, okay, so what I'm hearing you say is this is what we need to do. This is how it's going to work, and I also like to clear up, how accessible are you through the portal? Because, some people, some doctors love the portal. They communicate through the portal. other doctors are like, no, call the office, call a nurse, get triage, so I also think that that's an important thing to establish before you leave is with that provider, what's the best way to contact you in between appointments? So you don't feel kind of like left in limbo until the next appointment comes.
And for me, I need to know what I need to write down so I remember it, because I'm always exhausted at the end of every appointment. Does the after visit summary that they print out for me, does it have all the answers? The who, what, when, where, why, how? Or do I need to take those notes or have somebody else take those notes? So I actually will read the after visit summary to see if I need to add anything to that just for myself. Even though most of the time they do capture what I need to know quite nicely. And if there is a phone number, I have them always write it in there so that I don't have to go look it up. And yes, they're in the portal, but I'm old school and I do like the paper sometimes to be able to refer to, especially if I need to then show it to another clinician later. So I can just have it and hand it to them instead of having to have them find it in the portal, which everything isn't always easily accessible. So yeah, make sure your plan is safe for you and you have an actual secure plan and a plan to leave home, and also communication back.
And I think these skills just kind of also get easier as you practice them. Like we've been doing clinic now for 9 years. So we kind of, have our routine. We know what we need to ask before we leave. Like, it will get better and you get better yourself as you do it more.
Yeah. Patienthood's an experience.
It is.
Patient.
And feeling overwhelmed before you go into appointments, especially at the beginning, or during more times of crises. It's not your fault. You're not feeling, that's a normal cycle of life, feeling overwhelmed at times. So I always just like to try to take a deep breath, bring in a friend, write things down, and get the support you need. And ask your clinicians, ask your doctor, ask the MA, ask the nurse practitioner, whoever, to support you in whatever ways you need for your nutrition support. And also if you need support coping with coping with being on nutrition support and some of the stresses into your life and your family. So
yeah, I love that, because every clinic typically has a social worker, an outpatient social worker that you can tap into. So that's a good call out, Crystal. Never be afraid to ask for those resources and that support, because it can make a big difference.
Yeah, our care team has social workers and they've been everything to me. Like, they literally are the reason why, we have a lot of support. They've helped me through everything at our appointments where I just don't feel heard, for school stuff, just for everything.
Thank you for listening to Unclamped. We hope these tips and tricks have been helpful, and we hope you have a very successful next appointment. Please follow us on our social media and YouTube and Spotify.
We want to thank you for tuning in with us on Unclamped. We hope today's conversation reminded you that every diagnosis holds a story, one of strength, compassion, and connection. We want to give a heartfelt thank you to our sponsor, AvivoRx, for their commitment to supporting patients and families through their nutrition support journey. Their dedication makes conversations like this possible and provides a platform for the patient voice. We'd also love to hear from you too. If you have a story to share or a topic you'd like us to explore, reach out anytime at nutritiongroup4all@gmail.com. And be sure to find us on YouTube, follow along on our social media, and listen wherever you get your podcasts. Thank you.